unmute. You have to hit. The broadcast will be starting in 5 minutes. Good afternoon and welcome to this webinar featuring a new report on the status of healthcare transition in the states and in the nation. This presentation is sponsored by GOT Transition, the National Healthcare Transition Center. My name is Ann Walls and I am the project manager for GOT Transition. As many of you know, we are a new national center funded by a cooperative agreement between the Maternal and Child Health Bureau and the Center for Medical Home Improvement, which is the GOT Transition home base. In a minute, you'll be hearing more about the GOT Transition Center from one of the center's co-directors, Dr. Carl Cooley. This is GOT Transition's first webinar, the first of many more to come. I am pleased to report that we have over 290 registered for today's event. We are planning to add participants. Good afternoon and welcome to this webinar featuring a new report on the status of healthcare transition in the states and in the nation. This presentation is sponsored by GOT Transition, the National Healthcare Transition Center. My name is Ann Walls and I am the project manager for GOT Transition. As many of you know, we are a new national center funded by a cooperative agreement between the Maternal and Child Health Bureau and the Center for Medical Home Improvement, the GOT Transition Home Base. In a minute, you'll be hearing more about GOT Transition from one of the center's co-directors, Dr. Carl Cooley. This is the first GOT Transition webinar, the first of many more to come. I am pleased to report that we have over 290 registered for today's event. We are planning to add participants' contact information to our GOT Transition database so that we can notify you of future GOT Transition webinars and developments of interest. Please contact me by email to let me know if you do not wish to be added to the list. I will repeat this message at the end of the webinar when you will see my email address. I will note that many of you are already on that list, which is perhaps how you learned about this webinar today. I'd like to thank the Association of Maternal and Child Health Programs and the American Academy of Pediatrics for assisting us in disseminating the registration information for today's webinar. A few procedural notes about today's webinar. All participants except speakers are on mute. If you wish to submit a written question, please do so in the question field box on your control panel. During the Q&A in the presentations, I will read a few questions submitted, but unfortunately our time is limited. Those questions we can't get to will be compiled in an anonymous Q&A and posted on our GOT Transition webinar. Our first speaker today is Carl Cooley, co-director of GOT Transition. He will be providing a brief overview of GOT Transition. Then he will turn the presentation over to Katherine Rogers and Peggy McManus of the National Alliance to Advance Adolescent Health. They will provide a summary of their analysis of transition outcome data and the state Title V transition initiatives and activities. Thank you again for joining us. We appreciate your completing an evaluation of this webinar, which will be automatically sent to all participants. I also want to remind you that this webinar is being recorded, so you may access it from our website, and it will also be sent to you at the conclusion of the webinar. Now we'll begin this webinar with a brief presentation about our new center from Dr. Carl Cooley. Carl?
Yes, good afternoon, everyone. I'm sorry if we've been having a little bit of audio trouble. I hope my voice is coming through clearly for all of you. We're delighted to have so many participants and individuals interested. This is our first webinar that we're hoping to be the beginning of an effective series. And I am advancing slides. We're going to focus on a new report on the status of healthcare transition in the states and the nation. It was prepared for us in our partnership with the National Alliance to Advance Adolescent Health. The report itself is available to download at our website, www.gottransition.org, and we encourage you to do so. Just briefly, the agenda will include a little bit of an overview by me about the National Center and our plans and our activities so far, and then presentations by Katherine Rogers and Peggy McManus of the National Alliance, presenting the content of that report, and just some announcements at the end. I'd like to introduce the staff of the National Center. Here at the Center for Medical Home Improvement, which is the headquarters for the center, besides myself, or Jean McAllister, the other co-director, and Walls, the project manager, and telecommuting to us from her home in Leeds, Maine, Mallory Sear, who is our National Youth Program Manager. We also have an advisory, a cabinet, that provides some of our direct governance and meets on a regular basis, and their names are listed on the slide. In addition, there's a National Healthcare Transition Advisory, including about 25 national experts. We're supported through a cooperative agreement from the U.S. Maternal and Child Health Bureau. I just wanted to briefly indicate the focus and goals of our work as we're planning in the next over the next 3 years. First of all, and this is really the subject of today's webinar, identify unmet healthcare transition needs, barriers, and strategic opportunities, particularly with respect to Title V programs and other MCHB grantees. Secondly, and this is really one of the major focus areas of our work, identify evidence-based practices and innovative strategies to support the transition from pediatric to adult healthcare. This is really assuring that healthcare transition best practices are implemented at the primary and specialty care level in both pediatric and adult medical settings. In order to achieve this goal, we're in the process of rolling out 3 regional learning collaboratives, one in Washington, D.C., which has already begun its work, one in Denver that will begin in June, and one in Boston that will begin in September. In each of these areas, there are practices in both pediatric and adult care, in primarily primary care, but some specialty care practices that will be partnering to implement transition best practices on the ground at the practice level, something that we think needs both demonstration and vetting of tools, and we'll be sharing the results of those collaboratives as they begin to roll out later this year. Our other goals include working collaboratively to strengthen and expand youth and family participation and leadership in healthcare transition planning, policy development, and research, identifying and encouraging financial and non-financial system changes that facilitate transition outcomes, and establishing and maintaining the healthcare transition information exchange, which is something we hope we can involve all of you in as we try to share information about our experiences and our accomplishments. And with that, we really are looking for working with all of you to try to pull the threads of this tapestry together by working together, and invite your input and conversation with us at any time. There's a little bit of time for questions regarding the National Center, and then I'd like to be able to move into our primary presentation as quickly as possible. As Ann said, these questions will need to be posed through the questions section on your control panel. And Anne is going to read a few of the questions, and I'll do my best to answer them. We thought that this might be simpler than having verbal questions.
So, Carl, the first question is, for how long will the National Healthcare Transition Center be funded?
Our cooperative agreement is a 3-year grant that began in July of 2010. So our funding will continue until the end of June 2013. We have a lot to do in that short time, and we've been working quickly to try to get that underway.
Okay, the next question is, are the learning collaboratives open, or does a practice need to be invited?
The learning collaboratives that I described are already populated with practices. One of our efforts in submitting our proposal for this cooperative agreement was to have lined up those practices, those dyads of pediatric and adult practices ahead of time so that we wouldn't spend a lot of time recruiting. But we're anticipating, once we've completed most of the experience with the learning collaboratives, and that may be sometime at the end of this year, to invite secondary learning collaborative and other kinds of quality improvement activities to join us and hopefully make use of what we've learned in this learning collaborative. So we look forward to providing some resource and technical assistance to others undertaking such collaboratives beginning later this year.
And I don't think I'm seeing any other questions at this time, Carl.
Okay, there was one about the availability of the PowerPoint presentation, and I would say that along with the report that we've mentioned, we can put these slides on our website as well for people to download.
That's right.
And at this point, I'd like to hand the podium, so to speak, over to Katherine Rogers at the National Alliance to Advance Adolescent Health.
Okay, good afternoon, everybody. I am not quite sure I have control of the slides, but I don't think I have control of the slides. So I'm going to go ahead and get started and see if somebody else can just advance to the next slide. There we go. So this afternoon, Peggy, McManus, and I will be presenting on some of the needs assessment work we've done in conjunction with the National Center. And on the next slide, just a brief overview of what we'll be discussing today. Can I get the next slide? Thanks. I'll be talking briefly about measurement of the transition core outcome in the National Survey of Children and Youth with Special Healthcare Needs, and looking at, from that survey, some national transition results, some state results, and state variation in the transition outcome, and some factors associated with that variation. And then Peggy will discuss our preliminary review of state Title V transition efforts and innovations through our Block Grant Narrative Review. Can I have the next slide? So the purpose of our needs assessment activities at the National Center is threefold. First, we want to provide a set of transition benchmarks to permit states and MCHB to look at specific transition gaps. We also want to identify some factors that are involved in influencing transition outcomes and shape improvements and priorities for action for states. So there are two phases, as I mentioned, of our needs assessment work here. The first step was an analysis of the national survey data, and the second part is the analysis of state Title V efforts, looking at the block grant narrative. Can I have the next slide? So most of you are probably familiar with this, but transition is a national core outcome for children and youth with special healthcare needs, and it's one of 6, and it has the lowest performance of any of these 6. Only 41% of youth with special healthcare needs receive the supports they need, as measured by the national survey, to transitioned successfully to adult health care and independence. The next slide. This core outcome, as I mentioned, is measured via 4 component questions on the National Survey of Children with Special Health Care Needs. And adolescents have to meet the threshold criteria on all 4 questions to be considered to have successfully met the transition core outcome. I have 2 of the questions here. There's 2 on the next slide, but I'll just run through these briefly. The first question, do any, and these are posed to parents of, for the most part, adolescents ages 12 through 17, do any of the child's doctors or other healthcare providers treat only children? And have they, if so, have they talked with you about having your child eventually see doctors or other providers who treat adults? And if not, would that discussion have been helpful to you? Do your child's doctors or other healthcare providers talk with your child about changing healthcare needs as he or she becomes an adult? And if not, would that conversation have been helpful to you? Next slide. And the other 2 questions, one about health insurance. Has anyone discussed with you how to obtain or maintain health insurance coverage as your child gets older? And if not, would that discussion have been helpful? And finally, how often do your child's doctors or providers encourage him or her to take responsibility for his or her own health care needs? The data from the National Survey is available online through the Data Resource Center for Child and Adolescent Health. You can visit them at childhealthdata.org. And we'd like to thank the staff of the Data Resource Center for all their help in preparing this report, and in our data analysis, they've answered many of my questions so that we can provide this data to you. So a big thank you to them. Here are some initial national results. As I mentioned before, only 41% of youth with special health care needs ages 12 to 17 are meeting the transition outcome. You can see there are some important and noticeable disparities within certain groups based on race and ethnicity, a small disparity on gender, a large disparity based on whether or not the youth has a medical home. On the next slide, you can also see there are some big gaps based on family income and insurance status as well. On the next slide, we also looked at the state performance as the national survey is sampled individually in every state, and to look at state performance on the core outcome. There's wide variability. State performance ranges from 24% to 54%, and the standard deviation for state performance is over 6 percentage points. And about a third of states fall clustered right around the mean, within half a standard deviation above or below the mean. On the next slide, another 15 fall below that group, and only 2 fall more than 1.5 standard deviations below the mean. And another 18 perform higher than half a standard deviation above the mean, and that includes 3 which are above 1.5 standard deviations above the mean. This is a lot of numbers. All of this information is in the report, which I'll provide the link at the end of my presentation, but these are described in some national maps where you can actually see state variability. So on the next slide, looking at the component questions, states vary pretty widely in the proportion of youth meeting the threshold criteria for each component question, which, as I described before, impacts whether or not they're meeting the overall transition outcome. So on the question of whether or not healthcare providers encourage youth with special healthcare needs to take increased responsibility for their care, nationally, 28% are sometimes or never encouraged. There's not as much variability on this question. The lowest performance is about 34% and best performance at 21%. Those numbers are flipped just because we're looking at they are sometimes or never encouraged, which is not not meeting the criteria. On the next slide, a discussion about changing health needs is needed but has not happened. Nationally, about 38%. There's a bigger spread here, and on the next slide about the transition to an adult health care provider, which is where, actually, if you could go back one slide, we got ahead at some point. I'll just go over quickly the numbers about the transition to adult health care providers. Only 27% of families report that this decision is, 27% report that this discussion is needed but has not happened. the best performance here is 12%, which is really low and promising. I would like to add a note here that the way this question is asked in the national survey and the way this is measured, depending on the type of provider the youth sees, families get routed through this question a little bit differently. So it is possible for a parent to report that this discussion is not needed because their child sees a provider who sees both children and adults, and so a transition conversation is not needed. And so that influences how these results play out a little bit. On the next slide, a discussion about insurance is needed but has not happened. This is a big gap here, 66% nationwide, and in some states as high as 75% want this conversation, but it hasn't happened yet. So we'll go on to the next slide. So we wanted to examine some possible explanations for variability in state performance. And so we incorporated a couple additional demographic factors, family income, non-white race, and uninsurance status. And these were drawn from the current population survey data from the U.S. Census Bureau. We also included in the analysis in this portion of our work the proportion of youth with special health care needs seeing a pediatrician for their care using national survey data. And we combine these in a regression model where state performance on the core outcome was the dependent variable, and the independent variables we included were uninsurance, poverty, non-white race, and the proportion seeing a pediatrician for care. Importantly, in this model, the state is the unit of analysis, and so we're looking at the proportion of the state's adolescent population that is uninsured or living under 200% of poverty. On the next slide, we'll see the coefficients for this model, and these are negative and, for the most part, highly significant. You can go on to the next slide. Just to provide some explanation here, these are significant. They're all negative. A 1 percentage point increase in the uninsurance rate, for example, is associated with a 0.4% drop in the state's performance on this transition core outcome. This model we found to have high explanatory power. About 2/3 of the variation in the performance measure can be explained with using these 4 variables. On the next slide, I just want to acknowledge some important limitations to this particular analysis. Again, the state is the unit of analysis, so we're not looking at if this particular youth is uninsured, what is their likelihood to successfully meet the transition core outcome. As is often the case with adolescent survey data, these questions are posed to parents, not to the adolescents themselves. And as I mentioned before, the structure of some survey questions can confound the association between the provider type that an adolescent is seeing and on the transition outcome. And also, as you can imagine, just looking at our variables, there is expected to be some degree of collinearity in the variables we're looking at. We had originally included a variable for Hispanic ethnicity, and we tried a number of different transformations on this variable, and but we ultimately left it out as it was difficult to disentangle the overlapping effects it seemed to have with the other variables we included. The next slide, I think I have another slide. If you go 2 forward, just some implications of the analysis that we've done here. There are some improvements needed by all states to ensure successful transition of a large proportion of youth with special health care needs. And based on the data that we have here, improvements are likely to come with greater insurance coverage and greater access to medical homes, because that is where we see some large gaps. There's also some emphasis is needed to look at transition disparities by race and ethnicity, by income, and by insurance status. And this analysis here that we're presenting is certainly a good beginning here, but there's obviously a lot further to go in research to understand the racial disparities in transition performance. You can go back a couple slides. There's a link to the report. It's also available if you go to gottransition.org. It's prominently displayed on the front page. And if I think now I'll take a break for questions, if anybody has any.
Okay, Katherine, there's a question here. Were you able to look at the variability across metropolitan areas? The question is, I imagine that whether or not transition outcomes are met are tied closely to the policies and resources of what individual pediatric centers have.
Yeah, that's a very interesting question. And I believe what's often the case with these large national survey data sets, and I believe this is also the case with the national survey, the regional identifiers are often suppressed for ethical reasons to make sure that data is unidentifiable. But we certainly do find, just because we are very familiar with DC, this is where we work, and there are obviously different challenges for transition in a completely urban place such as Washington, D.C., as compared to other states with a more rural population, or at least a less urban population. So it's an important question. We weren't able to do it, we weren't able to address it in this analysis.
And here's another one, Katherine. Did you look at the state factors such as economics or demographics to look at how it affects the indicator?
Apart from looking at the proportion of adolescents living under 200% of the federal poverty level, that was the chief indicator of economic status. If the question pertains more to state fiscal status, we didn't look at that, but we did include poverty status as a way of getting at that.
And I'm not sure if anyone can answer this question, but I'll put it out there anyway. What proportion of affected adolescents now have insurance coverage under the new health care reform rules? That may be something that we'll have to research and get back, unless someone has any ideas about that.
Well, that would require a little deeper digging than I've done up to this point. So we can certainly get back to the whoever asked that question, maybe when the Q&A is posted.
And here's one last question for you. Do you know when a new national survey for children with special health care needs will be out? It would be interesting to see if the transition initiatives happening around the country have made a difference.
I am so glad you asked, because I was supposed to say that and I forgot. It's been fielded, and I believe the data will be available this fall. I think the data I was told was September of 2011. And importantly, the questions used on transition were the same as in the last wave of the national survey, which will be very useful in looking at this measure and seeing trends in this measure over time. And Katherine, there are more questions, but as I said, we'll be compiling them with the answers and posting them on our website. So I think at this point we'll move on to Peg. Okay, great. Thanks.
Thank you very much. It's really a pleasure to have this opportunity. Also to not only to participate doing this for the National Center, but from our local work in DC, we're very engaged in this work as well. Today I'd like to review with you some of our early findings from a review of the Title V block grant narratives. These are from their annual report for 2008, which these are the reports that state Title V maternal and child health agencies submit to the Federal Maternal and Child Health Bureau along with their applications to receive block grant support. So we have completed looking at all of these narratives, and we're now in the process of following up with each of the state Title V special needs directors. We're only about a third of the way through there, so what you're seeing today is really a preliminary review of what we're starting to see, but we thought you'd be quite interested in that. Once we complete this, we will set up a process with the National Center to review the innovations and then disseminate them on the GOT Transition website, and then start to develop more focused transition assistance. If I could have the next slide. There were several areas that we looked at in the narratives. These were needs assessment, partnership efforts, state priorities and leadership, transition progress anticipated. This is with respect to the national survey. Then we looked at specific transition activities, tools and resources, and technical assistance needs that the states articulated. Our next slide, please. Our early impressions were that there is an enormous amount of activity going on at the state level around transition, and I think it is a tribute to the efforts of the support that the Maternal and Child Health Bureau has put into transition, and also the past leadership of the Healthy and Ready to Work National Resource Center. So it really does appear as if we're on our second generation of transition efforts. So if I could begin now starting to tell you a little more about the first area we looked at, which was needs assessments. What we found was that few states are currently conducting transition needs assessment activities, and presumably that is because it was done in earlier years, and actually in every 5 years there's more of a comprehensive needs assessment that's done. So we were looking at the 2008 annual report. So we also found that almost all the states use the National Survey for Children with Special Needs to report on their transition outcome, but very few had really done an analysis of the sub-questions. So hopefully this report that Katherine just spoke about will be of use. Some states also mentioned previous transition surveys or focus groups that were conducted with youth and parents primarily, and sometimes with physicians. A couple of states, interestingly, mentioned that they were doing some analysis of their behavioral risk surveillance survey for adolescents and young adults with special needs. On to the next slide. With respect to partnership development, at the state interagency level, we found most states are involved in interagency transition efforts, and either the Title V agency, the Developmental Disabilities Group, or the Education Agency are in the lead. In addition, there were many parent partnership efforts going on around transition. Often what was mentioned was mentoring, training, and materials development. We were really pleased to see how many states reported youth partnership efforts with youth advisory groups. Oftentimes, not oftentimes, in about a handful of states, we also saw that there were actual transition leadership forums that were going on. We found much less going on with regard to healthcare provider partnership efforts. Again, I think it's important to recognize that some of this, what's going on in the state, is not always written in a block grant application, so that's why it's important that we're falling back with the states. And so this may increase substantially. Next slide, please. With respect to priorities and leadership at the state level, we found about 15 states had identified transition as a state priority. In these block grant applications, they actually specify their state priorities. So, of course, we would love to see it at 25 or 35, but 15 was good. And 10 states reported that they had a statewide transition task force or developed a state transition plan. Now, again, this number may increase with our queries to the states. And we had 2 states developed actual transition legislation in both instances to establish a statewide interagency council on transition. Moving next, we found 43 states using as their 2008 transition indicator, the same percentage that was reported in the 2005-2006 national survey. States anticipated making very small changes for the 5-year period between 2008 and 2013. We found 8 states thinking that they would make no improvements. More often, 23 states reported 1 to 4% point improvements, and 5 states anticipating making 5 to 10 percentage point improvements. I think it's clear from this that states are really not sure what it's going to take to influence transition improvements. Next. With respect to websites, I've done 2 things. I've actually gone on the states' websites as well as looked at the block grants, and we found about a third of states have a transition page on their Title V website or are using a separate transition website, often in collaboration with other organizations. On the next slide on education and training, A lot of states are involved in some form of transition education training. Many have created training programs for their care coordination staff. Some have done statewide transition training for agency personnel. Others have created training conferences for primary care providers, families, and youth. Interestingly, we found a couple of states had partnered with their state area health education center to create transition training modules. Next, on practice improvements. Over half of states mentioned in their block grant narrative that they were involved in some type of practice-based improvements. We often found mention of transition services provided in Title V supported clinics, mention of actual transition clinics, transition services incorporated into care coordination services, medical home expansions including transition, the use of transition specialists working in various clinic sites, and having actual transition educational office visits with community primary care practices. Moving next, we then looked at how, if states have been measuring their transition performance, and we were interested to see how many had actually developed guidelines and performance measures, and these are just some examples of what we're seeing as measures. For example, receipt of transition planning as part of comprehensive care plans, the documentation of completion of specific transition activities or checklists, or a completion of a transition plan, the proportion of patients ages 14 and 15 who report Title V transition services help to improve their knowledge and ability to transition to adult life, documentation of transition outreach and appointments starting as early as 11, and receipt of education in specific core areas, and some states had actually conducted satisfaction surveys around transition with youth. Now moving on to insurance and payment. What we found was more than 20 states reported on health insurance assistance that they're working on as part of their transition efforts. We heard about states helping youth and families complete waiver applications, putting on insurance and SSI workshops, expanding care managers' responsibilities to include insurance, making more information available about insurance options, actually kind of aggressively reaching out to adolescents prior to their 18th birthday to offer insurance assistance. Another one was collaborating with Medicaid to facilitate continuous coverage for older teens aging out of CHIP. And an interesting one we saw, creating a transitioning youth as a special eligibility and priority category for supported employment and other services. Next. There are so many different checklists, tools, workbooks, care plans, medical summaries, condition-specific fact sheets, videos. We are now collecting them, and we'll be working closely with the National Center to review those and actually try to make them more widely available. Not tons of them, but to kind of synthesize what we think are the best of these offerings. Finally, we looked at transition technical assistance needs. Again, we'll be asking this as well in the queries we make of the agencies, but a small number requested assistance in their block grant narratives, and these are the types of assistance that were needed on cultural competence, on strategic planning, on improving adolescent medical homes, on addressing barriers that limit youth's transition, and also strategies and tools. Someone had help on finding more employment and training for youth in transition, and improving transition from Title V programs into adult programs and making that referral process much more seamless. And then, interestingly, one state who had been developing a transition kits for different age groups wanted to start for the 5 to 7-year-olds. So that's just a very preview of what we're starting to see, and in the next 2 to 3 months we will be putting more of this information up on the GOT Transition website in a very organized way to help facilitate addressing the gaps and sharing best practices. So I think that's the end of our presentation. If you have any questions or answers.
Okay, Peg, there was one question that came in asking about whether any states report innovative strategies for the financing of transition efforts.
The examples that we gave on the insurance and payment were so far all that we have found. Now, again, we're querying the state agencies, so there might be more activities going on, and we will certainly share that on the GOT Transition website.
Here's another one. Were you able to look at what states are doing for the subpopulations you mentioned in the earlier analysis? Racial and ethnic groups, people in poverty, or those with inadequate or no insurance?
You know, we have tried to pull that out. There isn't as much that has been written about that in the block grant narratives, but we're querying about the states in our follow-up to the emails to the states. So we will definitely put more of that information in as we make it available.
Here's a question. Were there any states that were looking at the outcomes of transitioning youth? Performance indicators appear to be more process or satisfaction related.
That's a very good question. We did not see that at this point, and I don't know if states have developed that. We will certainly share with it. This is an issue that has been raised by our advisory group about that these were very much process measures and not outcome measures. So we're quite aware of that limitation of what's being measured here.
Here's a question. Have the programs providing education to youth about transition been specific to health?
I'm not totally sure I'm fully understanding that question. I didn't report on this, but we're also looking at what the states have been doing around education transition planning. That's such a huge area, and it has been much more evolved than in the healthcare transition piece. So we probably won't be devoting a whole lot of attention to it, but there's quite a bit going on, and we will include that in the future on the GOT Transition website.
And this is a question that maybe Carl can answer. Is there going to be a multi-agency statement coming out related to youth and with special health care needs and transition?
Yes, this is Carl, and I was planning to make everyone aware of this at the end of the webinar, but and many of you are aware that the American Academy of Pediatrics, in partnership with the American Academy of Family Physicians and the American College of Physicians, which is the professional organization for internal medicine physicians, will be publishing a new joint clinical report on healthcare transition, hopefully by the middle of this summer. The timing of this is still a little bit unclear, but the current draft of this report has been endorsed and approved by the boards of the Academy of Pediatrics, the Academy of Family Physicians, and the American College of Physicians. So we're really in the final stages of putting forth this report. And it will be a practice level, very practical algorithm-based guidance for primary care practices to implement best transition practices. And the endorsement of the professional organizations really carries the message to their membership that this is in fact the kind of best practice that they expect of the members. I think its publication will increase the interest in those organizations for more educational offerings around healthcare transition and around the implementation of better practices.
There was a question relative to what the center might be doing for adult providers relative to transition.
Now, this is, I think, everybody's, if not main concern, one of the main concerns is the impression that at least with respect to youth who have complex childhood onset conditions, sometimes rare conditions, that adult primary care providers and often specialty care providers don't feel prepared to meet their needs and provide care. In one respect, this is an educational hill that we're going to need to be climbing, and we're certainly interested in doing that. In another respect, I think trying to look at what kinds of tools would make adult primary care providers more comfortable with those complex needs and feel adequately supported. There may be models of scenarios in which specialty care doesn't transition right away and specialty providers become decision support resources for adult providers. There also may be models in which the former pediatric primary care physician can become a consultant to the new adult primary care physician. I think we'll need a variety of strategies to attack this problem, including the training of medical students and residents in training programs.
Here's a question. I'm not sure if it's in anyone's domain here, but I'll put it out anyway. Will it be possible to add more transition-related questions to the next round of the national survey for children with special health care needs? I don't know if...
Peggy or Katherine?
Hi, this is Katherine. So the next round, and if I can add my numbers correctly, the next round would be 2013, 2014, and I think that there has been at least, some discussion of the transition questions in, just common conversation. I don't know that I'm not familiar with what is being discussed at the actual survey design level. So it's certainly. The questions are modified on the survey periodically, but I don't know that there's anything, I'm not sure of anything being in the works for the next round. We can find out and post it in the Q&A when that gets posted, if that works for the questioner.
And certainly if there's anyone participating in the webinar who has answers or comments or thoughts about the questions that you've heard, feel free to communicate those by email to Ann Walls. Her email address will be on the last slide today when we finish up. But we'd love to hear more than just your questions, your knowledge and your observations as well. As Ann mentioned at the beginning, we'll be tabulating all of the questions that have come in and communicating responses through the GOT Transition website and as quickly as we can.
Thanks, Carl. I think at this point we'll move along. I'm sorry we didn't show this slide earlier. This was contact information for Katherine and Peggy.
Leave it there for a second for people to see.
Sure.
So this is Carl again, and I just wanted to give you an idea of things that are coming. As you'll see when you do, if you haven't already visited the gottransition.org website, that it is still under construction but is up and running. It has, I would say, I guess, breadth but not depth yet, but we are actively working on that, and those of you who have developed websites know that it is a difficult task, sometimes tedious, to get all of the information there, but we intend for it to be useful for families and youth, for professionals, healthcare professionals in particular, for state and national policymakers and grantees, and perhaps for others as well. So keep looking, and we'll send out announcements as its offerings expand. You can also join Got Transition on Facebook. Mallory Sear is ably managing our Facebook presence and assuring that there are new items and new information there all of the time. And we'd love to have any of you join and like our Facebook page, and certainly would be happy to hear about yours as well. We are planning as another means of communication a radio talk show that will be internet-based, but designed after the Institute for Healthcare Improvement's very popular talk show. Eileen Forlenza from Colorado and Mallory Sear from our office will be hosting those shows when they begin in the coming months. We anticipate a second webinar. We hope to be producing these at least quarterly in late June or early July. This will focus, first of all, on the early results of our learning collaboratives, and it will be an opportunity for those of you with questions about the learning collaboratives to get more information and perhaps let us know of efforts that you're making or planning in your localities. And I am hoping that it will be an opportunity to introduce the clinical report that I referenced earlier. Its publication should at least be pending by that time, and it may be possible for it to have become unembargoed enough that we can share some of its contents with you as a early preview. But and I want to apologize again for the audio difficulties at the beginning of the webinar. There were almost 300 people who registered for the webinar, and I'm sure that some will have difficulty with that number, and we know that some of the early difficulties stemmed from our end, but we'll do everything we can to fix those problems in the future.
Hey, Carl.
The last slide, I think, gives you contact information for Ann Walls. Any who would like not to be on our communication list in terms of your email, please let Ann know in the next few days. And if you have other comments or feedback for Ann, I'm sure she'd be glad to hear it. Shortly after the conclusion to the webinar, you'll be receiving the opportunity or a link along with a thank you for participating to a survey, and we'd love to have your feedback. In particular, we'd like to know what topics you would want to hear about in the future, so we can begin orchestrating the future presentations. Ann, do you have any final comments?
No, I think you've covered it all, Carl. Appreciate that. Again, we will just automatically be putting your contact names onto our list, your contact and emails, unless, of course, you're already on that list. But please do email me at that email address on the screen to let me know if you do not want to be listed. And again, as Carl said, we're looking for your evaluation of this webinar as well as your ideas for future topics. And we do so appreciate your participating in this webinar. We look forward to more webinars with you, and